All right, good afternoon. I'm Norb Kaminsky, and I would like to welcome you to the Michigan State University Center for Research on Ingredient Safety's annual Science Symposium. For those of you that may not be familiar with CRIS, our mission is to conduct research and provide insight on the safety of ingredients in food and consumer products to support evidence-informed decisions by consumers, industry, and policymakers. The theme for today's symposium is new approach methodologies in support of weight of evidence assessments for regulatory decisions in immunotoxicology. By way of background, there's been a growing emphasis in the discipline of toxicology to move away from animal testing and move toward in vitro-based safety assessments. With that, questions and concerns have been raised on whether there is sufficient confidence in new approach methodologies to make this transition. In part, this is driven by questions on whether specific new approach methodologies capture the complexity of in vivo biology that currently is being used for safety assessments. Similarly, emphasis has been placed on the reproducibility of specific new approach methodologies and their validation for use in making regulatory decisions. The counter-argument is that the majority of safety testing historically has been performed in animal models, mostly rodents, and clearly rodents are not a complete surrogate for people. The goal of today's symposium is to begin by having Kelly McGurney from NSF International discuss a framework she recently published with colleagues, including Dr. Sue Marty, who's also one of our speakers this afternoon from the Dow Chemical Company. And the title of this paper was a pragmatic framework for the application of new approach methodologies in One Health toxicological risk assessment. We'll then have Dr. Marshall from the Humane Society of the United States then speak to the poor translatability of research in animal models in the area of therapeutics. And of course, this also raises questions about safety testing and the translatability of those data. This will be followed by 3 presentations, one from agrochemical area or sector, from the cosmetic sector and pharmaceutical sector, which will provide examples where new approach methodologies successfully contributed to safety assessment and regulatory decisions. These presentations will be by Drs. Marty, Liu, and Getz. We then have a presentation by Dr. Kaplan, who has served on an advisory committee to support the Japanese effort toward establishment of new approach methodologies for immunotoxicology safety testing. And that will close the symposium with a panel discussion to begin discussing how the lessons learned in the presentations today can be used to begin to establish new approach methodologies in support of weight of evidence assessments for regulatory decisions in immunotoxicology. So we'll see what lessons we can learn to move forward.